Hi, Kris. Thanks so much for joining us today. And thanks everyone in the audience for watching another Jellypod customer story. I want to jump in and ask one quick question. What was a pleasant surprise, an unexpected surprise you had from using Jellypod?
Well, it happened today. It's not a joke, but I uploaded my first recording in French. All my other podcasts are in English. In French, my French is not good, and I received an email to congratulate me with my voice and my accent in French. But it's the voice clone. And the thing is, and they will be surprised if they hear it, it was from my parents. So my parents didn't recognize that the voice clone was not me. I think we had a laugh with the kids during dinner about that. So that happened today.
Oh, that's so cool. Yeah, the ability to speak languages that we don't speak in our voice fluently is such an uncanny thing. That's awesome. Yeah, I did something similar to my grandpa, who's Indonesian, and I don't speak Indonesian, but I gave him a blurb. And he's like, "When did you learn this? How did you?" He started talking to me in Indonesian. I was like, "I don't understand it."
So funny.
But that's amazing. Well, thanks, Kris. Could you tell us the audience a bit about yourself to sort of set the stage, who you are, what you do, etc.
Yeah. I'm working in at university. I'm a full professor in Belgium at the Leuven University, KU Leuven, large university, old university, 600 years old, the university. I'm in the Faculty of Medicine, but my topic of interest is quality and patient safety of patient care. So I'm not a clinician, I'm in healthcare management, but I train a lot of clinicians and healthcare managers about quality, patient safety, things that go wrong, things that go brilliant, super things. And I use a podcast right now to help me in my teaching.
Very cool. Very cool. Yeah, we're seeing a lot of people, a lot of professors in medical schools, doctors, etc. A lot of people are turning towards Jellypod. It's interesting. It's like a funny combination. I guess it's we're always learning about all the different use cases in the medical space. Could you tell us a bit about what were you trying before you discovered Jellypod? So you're obviously, you're teaching students in the medical school, and what were you trying to accomplish like right before Jellypod that Jellypod may have helped you unlock?
Well, I was searching for a new way to get to the students. I'm 51. Some of my students in medical school, for example, I start teaching from the first year of medical school. They're only 18 years old. So we have to try to find some new things. So I've done a lot of teaching over the past years. And then also during COVID, we had live streams of our classes or recordings. But sometimes in my field of expertise, we discuss some things that cannot be recorded, some case studies. So we have to be very careful with streaming, with recordings, live recordings, because sometimes you explain or students explain what they felt or what they found or what they did, or sometimes things go wrong. So what I found, if we were recording the classes, the interaction was lost. So I was trying to find a way to teach them, but also to give them something afterwards. And so I was trying first to do some video recordings, but that was quite not so interesting to do. And then I was searching for some new ways. I found the podcasts. I was not a podcast listener, but I heard from my students, they were saying, well, podcasts could be something interesting. And then, of course, with the AI supported podcast, where I can use the content that I use are the voice recordings of my classes. So that's my starting point of my Jellypod podcast. And I add literature of own research or a colleague's research. And that combination makes sure that the content is okay. And so the starting point, most of the time, it's my voice recording of my class. So I just tape them with my iPhone, and
Mm,
then I use it. I use a transcript for that, and the transcript is the basic scenario for the podcast,
cool. Yeah.
and it
This.
works.
Sorry. Amazing. Glad it works. No, that's awesome. I love the idea of remixing the lecture, right? Because it's like so often, if you sit through a lecture, certain students will then sit through the exact same lecture twice. But that's not most students. So to remix it and have it be unique, so there's because part of content consumption is the joy of discovery. It's the joy of hearing something new, regardless of what it's about. So to remix the content and give it new life, you get like the repetition, but in a
So last week I took exams at Leuven University within the Master in Healthcare Management. And there was one student who told me every evening I went for a walk for half an hour and I listened to an episode. And so I was studying your material and the slides and the readings, but the podcasts were a kind of summary of what I was learning. So I went just outside for a walk, and then I listened to the podcast. So and he had great points, so it worked.
Yeah, that's fantastic. Yeah, so for all the students watching, get your professors to make a AI podcast because you'll get better grades and everyone will be happier for it. No, that's so cool. And just as like a meta riff, you're in the medical school, you're all about health. Now your students, instead of sitting in a quiet, dingy room for 30 minutes, get to go for a walk. So they get to like be healthier while learning about medicine. So, you're killing two birds with one stone, as they say. You said that you wanted to create this content, as a leave behind. You were looking for lots of different things, and eventually you stumbled on podcast. Why was it so important for you to have this leave behind? Was there a bigger picture or a specific moment where you were like, we need to have something cool for the students?
Well, it was a combination, to be honest. Well, I'm 51. I've been teaching now for years. And in the beginning of your career, you think I have to keep all my material and all the content that I have. I have to keep it for myself. But now my podcasts are used, for example, by a colleague in the French-speaking side of the country, but
Mm,
also in Canada,
wow.
where it is used by a colleague who is saying, "Well, I am teaching the same type of classes. I will offer it to my students." And something must have happened over the past few days, because I see that the numbers on Spotify are increasing, and so somebody's using it. And well, it's good. We have to, in my area of interest, there is so much room for improvement that care has to be perfect when I will need it. And that will be in 10 to 15 years, maybe.
Mm,
So we will spread the ideas and try to inspire people. But they will not have all the content. It will be the summaries with the podcast. So it's a win-win. But the international audience right now, that's impressive. That's impressive.
totally.
And certainly now also with translating them into other languages. So I received a question from Germany. Can you also do them in German? But yeah, that's possible. That will be possible.
Yeah.
Maybe in Indonesian. Why not?
Why not? Go.
Why not?
Yeah, the classroom has gone transcontinental. You're
Yeah,
going, so you're already hitting. You're in two countries, but in like three different, like the French in Quebec, I imagine, is different than the French in Belgium.
that's it.
So
And
you're
that was,
like,
that was a topic when we were first doing the tryout of the language
yeah.
change on the podcast. So that my French speaking colleague was saying, well, that's French from Quebec. We have to use another clone so that it's French French. So we changed it. We searched for half an hour and then we re recorded the voice clone, and it was much Frencher. So we are
Mm,
using that one right now. So it's always, it's super, the software, but it's also helpful that I have a deal with a French speaking colleague
hmm
who can see that the words and the translations are perfect, and because my French is not good enough to find to have the real small
mm.
things that are correct. So but it saves us, I think, weeks of time, the software, not days, more.
Totally. Well, yeah, I mean, especially I mean, this use case going across multiple languages and doing it well and exciting people in multiple languages. That's incredible. Usually, people are like, all right, I want to grow, but other languages are an afterthought. But in your case, it's almost, it's they're equals. It's multiplying the impact. I mean, that's so cool. It makes us want to streamline this process for you and make it easier to translate across clones. I'm gonna take some thoughts after this call and put it into our roadmap. But so very cool. You're educating the world, and you have this sort of this meta goal of, just in case the doctor in Quebec, immigrates to Belgium, is the one taking care of you 15 years from now. They learned it right. They learned it right the first time, which is great. What options did you consider for this? So you're looking for a new leave behind, looking for content. Were there other tools that you had looked into to help make these podcasts?
Well, I think one of the interesting things is that we could use videos, and also there with clones, and that would be possible. The podcast is working right now, so maybe it could be a next step to use an avatar or something. For that, the words are important. So what I'm teaching is not very technical. It's more to convince people about and change their way of thinking about quality. So
Mm,
I'm not teaching very technical things. I'm trying to get them involved in the way of thinking, in some paradigms, in some concepts. And therefore, you need words. Visuals could be helpful, but the words are important because they have to think about it. So I think the podcast will be less obvious for some very technical things. You cannot teach anatomy in a podcast. I think it's very difficult to teach anatomy, but to teach them management skills and some things that they have to think about, that could be very interesting. So that's why we are using the Jellypod software right now.
Makes sense. Yeah, and I think I can't remember exactly the details of this research, but I've seen research about um, I think people think better when they're walking or something. Like you know how when you're in your room and you have a difficult problem that you're thinking about, you just instinctively will get up and start pacing around the room or something.
You do
So
that when you're on the phone. When you're on the phone, you stand up and you walk around. It's
totally.
the same here.
Exactly. Whatever that thing is, whatever part of our legs makes our ears work better. Uh, yeah, I'll have to take an anatomy course to learn exactly the connection between legs and ears. But nonetheless, yeah, I think it's awesome that you're unlocking this new way of making an impact and shifting the way people think. What did success look like in your first couple episodes?
Well, it was feedback that we received, but also that we really could fine tune the content. And even before it was online, it was helpful for myself. The first episode I didn't put online; I just gave to the students. So I received some feedback, some colleagues that I asked to listen to it, an international enter. Hey, listen to this. What do you think? Well, it's great. Maybe we could do some things together on that. So that was the first feedback. And so I have a list right now of about 10 other topics that people are telling me it would be interesting, Kris, to tell something about this topic.
Mm,
And so I have a whole list. It's not possible to make. Well, I do it in the evening or during weekends, but the positive feedback that people are listening, and if I now look at the numbers, and the numbers are not the big numbers, that these are a few hundred people. But if I see and I receive via LinkedIn, for example, the feedback from people, or I see who is listening to it, then I'm surprised. Or people that I bumped into a medical director of a hospital that I do not collaborate with, but he told me, "Hey, Kris, I listened to the podcast." And I thought,
wow.
how did you know? Oh, it was on LinkedIn. Yeah, of course it was on LinkedIn. So people are listening. It's not because of our 20 minutes of fame, because then we would use videos. But now it's the voice. So we really, well, I think it's a good way to try to convince the people with our message, but not just the message because we think that it's okay, but the message that is based in our back office with hard evidence. The papers are published in peer-reviewed journals, and we are now making summaries of those papers that nobody reads,
Yeah,
only PhD students, I think.
totally, totally.
So that's an interesting thing.
No, absolutely. I think, and maybe we were starting off this conversation about, why are so many people in the medical industry or in the medical discipline using Jellypod, and perhaps it's the accessibility of difficult to understand content that we in Jellypod, we always talk about we're trying to unlock untapped expertise, and we believe that there's that 99% of the world's expertise is trapped away and the world does not get to benefit from it in a meaningful way in their day-to-day lives. And we hope that this makes it accessible. And it sounds like it's certainly working for you, which is great to hear. I can't, there's so many more papers, so many more peer-reviewed papers to
Yeah.
turn into a podcast. So that's amazing. On that topic, kind of, what's your favorite episode? Well, what was it about? Was it about a particular paper or?
Well, I received some positive feedback from different groups internationally on the last one that we uploaded. It's an important topic is the impact on clinicians if they are when they are involved in adverse events. When something goes wrong with a patient,
Mm,
can be a mistake, slip, lapse, or something that complication. What is the psychological impact on these clinicians? We call them second victims after adverse events. The first victim is the patient. The second victim is the healthcare professional, a nurse, a pharmacist, physiotherapist, a medical doctor. So my last podcast was to explain to the people what the impact on clinicians, multidisciplinary, not only doctors, is when they are involved in unanticipated errors. It's a very difficult thing to talk about because it's a taboo. But very interesting feedback right now that people are saying, well, I recognize the symptoms that you are describing. I recognize them. So people are listening to it. Well, somebody told me it's a type of therapy listening to it, because I
Mm.
now recognize that I'm not the only one suffering after the incident, because I made a mistake. It was not it was, well, it happened. Shit, it happened. Now I'm awake, I don't sleep, I'm hyper vigilant. And you talk about those things in the podcast. Well, so that feedback,
Wow, wow. I didn't. I
that's
doubt you would have.
that's more than interesting.
Totally. No, that's layers to it, right? It's, we were just talking about the meta riff of, you're helping someone be healthier by walking, by listening, so they're learning while walking. So that there's two levels to that medicine. But now you're going a
Yeah.
third. Now you're treating people through the podcast. Not only,
Well, that's only on that topic, but also we have some podcasts about the positive effects, the very small things. We call them mango moments.
mm,
It means the very small acts of kindness that you can offer to a patient or family member of a patient, and that gives you very interesting relation or a positive resonance between the people. That's the opposite of an adverse event. So we talk
mm,
about negative things, but we also talk about positive things in quality, of course. The best, we are delivering high quality care, but it's the fact that you can talk about it and explain some things. For these type of things, we do not need figures, tables, p-values. That's for the papers. If they want to know more, they know the papers. We can explain them the papers. So maybe that's also something that I have to remind, if I explain some things on the Jellypod podcast, that I can have a kind of table of with bibliography or references that they can. Maybe it's interesting to find something that this podcast is based on this evidence. That could be an interesting thing to for myself. Now I'm talking about it to you. That could be interesting that I give them a reader list. These are the 5 things that you can, if you want to find out more, these are the things. So then it's really teaching, and it's a whole package, I think. So
totally, totally.
yeah,
The fastest way that you can hack that together right now, and I know this isn't satisfactory, is on the podcast level. We'd let you have links, so you could link to a Google Doc that has perhaps a bit. We used to expose the sources that went into an episode as like linkable elements, but some people didn't like that. They didn't want to see all the sources. But this is,
I don't want to give the whole transcript of my voice recording of my class, because there are things in there that cannot be in
I
the
see,
in the episodes because of
I see. That makes sense.
legal.
Totally, but this to me sounds like how like the way you can add in links at the podcast level, basically add in links at the episode level. Someone's watching the episode. The only hard part is it seems like Spotify is a big place that you distribute. So we need to find a way to be able to get the bibliography into Spotify, which might be like
Yeah,
best.
Spotify and YouTube. I post them on Spotify and on YouTube, and then the marketing or to make people aware of it is LinkedIn. LinkedIn is really working. I have about 11,000 followers on LinkedIn, so that is working. And then I see also that you have sometimes 6,000 impressions on a post, so that's good, and it's working. And then you see the reposts, and then it's working and it's spreading. So, yeah,
Yeah,
but I
I
post
love
them
I
on
love your
Spotify
posts.
and on YouTube.
Yeah. Yeah, I love your posts. There's definitely a lot of engagement on it. People like the comments. I sort of read those sometimes and I'm like, yeah, like yes, like
Yeah,
people
yeah,
people
yeah, yeah,
people like this thing. This is great.
yeah. That's positive. That's positive. Your manga moment of the day.
My mango moment, yeah. Do mango moments offset adverse effects? Like, can you put them together, or are they kind of on two different
Well, they're the opposite.
dimensions?
The adverse event is the most negative thing that can happen to you in patient care. The manga moment is just the opposite. Is the positive thing. What
Totally,
the unexpected act of kindness we call it. That
absolutely,
sometimes and patients remember them years after they happened.
totally,
These
totally.
positive things. We always think that they only remember negative things, but we also have a place in our brain to remember positive things. That's one of the things that we're
Yeah,
talking
yeah,
about.
yeah. I just came across an article recently that talked about how like successful business managers, effectively what they do is they manufacture mango moments at the beginning of meeting somebody.
Yeah,
So they try and like some of the best, some of the best, I guess maybe politicians or people leaders or what have you will quickly identify the thing that'll like that will last in your head forever and lead with
yeah,
that. To
yeah. I don't think all politicians understand it really well. But no joke. Well, we define them as small acts of kindness and leadership. It's about leadership.
Leadership.
But also
That's the
talking
word.
about negative effects in patient care is also to be open, and so talking about it and making people think that works with podcasts.
Absolutely.
So I think it works. So thanks.
No problem. And I guess I have two final questions, kind of rapid fire. First one, what about Jellypod won you over? What was like the thing that you're like, I can see myself using this for a while?
Well, the first time I did a tryout, it worked, and I used some other things before. I will not use them anymore. I will go full on Jellypot and use your software. But to be honest, that I used chat. Sorry, but I asked a lot of stupid questions in the beginning.
No,
But
they were
you
great.
answered to all no, but you answered to all of them. You remember there were some podcasts who were too long, and we had a crash of the system. You didn't say, well, it doesn't work. You have to, no, we will find a solution. Give us some time. And that convinced me, okay, this is not in a big company. I hope that you will become a large company. But right now, the direct relation that I know, okay, these are the guys who are doing that, and I can ask them something, and I know they will find a solution, because it's at this moment that these questions help you in further developing the tool. That's something, well, sometimes I hope that you will stay small, but I know that you're a business, so it will be another way. But that convinced me. The answers to my first questions, that it was not something like, we don't know, or no answers like you sometimes have. So that was a very positive thing for me to say, okay, let's try it and then get the full thing.
Amazing. Well, thank you so much for bearing with those things. You know, some people it doesn't work and then they leave. So thank you for voicing your concerns. Anybody who's watching this, if you're watching this and you have anything at all, use the chat liberally. It goes to my phone. As long as I'm awake, I try and answer. Though we do have an AI bot now fielding the first batch of requests. We've reached a scale now where most people ask questions that are fairly straightforward to answer.
Of course.
So we've started automating those, but I comb through them every day. Final question. If you were to describe Jellypod to a friend in a single sentence, what would you say?
That Jellypod is offering super back office tools that let us shine in the front office. And front office and back office in management. In management, very important. In our patient care, the patient care is the front office. The organization is the back office. I think what you're doing is to give us back office tools and support, so we can shine in the front office when we are teaching and do our direct to our clients, which are students, which are colleagues, which are patient and kin. So the back office support there with the tools, with the live support, with the chat, with the robots, but it makes us shine in the front office. So that would be my answer.
Amazing, amazing. Helping the back office shine in the front office through podcasting in multiple languages in multiple countries. Coming to Indonesia soon. Kris,
Thank you.
thank you so much. It
It
was a
was my pleasure.
fantastic conversation. Thank you,
Thanks to
thank
you
you.
and to the team.
Yes, I will pass that along. And thank you. Have a good one.
Bye bye.